Hello and welcome to Living Diabetes, the podcast where we explore various health topics to empower you with knowledge and insights. In this podcast, we will discuss how diabetes is diagnosed. Before this, we will briefly talk about the basics of diabetes. Diabetes is a chronic medical condition that occurs when the body is unable to regulate blood sugar levels properly. There are two main types of diabetes, type 1 and type 2. Before we delve into the diagnosis process, let's briefly understand the key differences between these types. Type 1 diabetes is an autoimmune condition in which the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. This leads to a lack of insulin, and individuals with type 1 diabetes requiring insulin injections to manage their blood sugar levels. On the other hand, type 2 diabetes is characterized by insulin resistance, where the body's cells do not effectively use insulin. As a result, the pancreas may produce extra insulin to compensate, but over time, it may not be able to keep up with the demand, leading to high blood sugar levels. Now that we have a basic understanding of diabetes types, let's talk about how diabetes is diagnosed. Early detection and diagnosis are essential for managing the condition and preventing complications. Regular checkups and awareness of risk factors can significantly improve the chances of catching diabetes in its early stages. The diagnostic process for diabetes typically involves a few key steps. First is symptoms evaluation. Healthcare professionals will consider common symptoms of diabetes, such as frequent urination, excessive thirst, unexplained weight loss, increased hunger, fatigue, and blurred vision. Second is blood glucose testing. The most common test to diagnose diabetes is the measurement of blood glucose levels. There are two primary methods: fasting blood sugar and oral glucose tolerance tests. In the fasting blood sugar test, a blood sample is taken after an overnight fast, and a glucose level of 7.0 mmol per liter or 126 milligrams per deciliter or higher on two separate occasions is indicative of diabetes. In the OGTT, the person fasts overnight and then their blood sugar is tested after drinking a sugary solution. A blood sugar level of 11.1 mmol per liter or 200 milligrams per deciliter or higher after 2 hours indicates diabetes. Third is hemoglobin A1C test. This test measures the average blood glucose level over the past 2 to 3 months. An HbA1c level of 6.5% or higher on two separate tests is considered diabetes. This test is particularly useful in monitoring diabetes management over time. Fourth is random blood sugar test. In some cases, a random blood sugar test may be used when symptoms are severe and diabetes is suspected. A blood sugar level of 11.1 mmol L or higher along with symptoms indicates diabetes. Urine tests can provide valuable information to healthcare professionals when assessing diabetes, but it's essential to understand their limitations. While a urine test can detect the presence of glucose, it cannot provide accurate measurements of blood sugar levels or the root cause of the condition. It is important to note that the diagnosis of diabetes is not solely based on a single test result. Healthcare professionals consider a combination of factors, including symptoms, blood tests, and risk assessments, to arrive at an accurate diagnosis. Early diagnosis is crucial because it allows for timely intervention and the adoption of lifestyle changes to manage diabetes effectively. With appropriate treatment and self-management, individuals with diabetes can lead a healthy and fulfilling life. That's all for today's episode of Living Diabetes. I hope you found this information on how diabetes is diagnosed informative and helpful. If you or anyone you know is at risk or experiencing symptoms, don't hesitate to consult a healthcare professional for proper evaluation and guidance. Remember to subscribe to our podcast for more insightful discussions on various health topics. If you have any suggestions for future episodes or want us to cover a specific health issue, feel free to reach out to us. Until next time, stay healthy and take care.